Good morning and welcome, everyone. Welcome to the Portage Substance Abuse and Mental Health Conference. We would like to start, we'd like to ask you to all please stand. We'd like to begin our program, stand and say the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Thank you and welcome to our annual conference. This is our first mental health and substance abuse conference. It's the fifth one we've had. Initially, we were having substance abuse conferences. They were an outgrowth of our Portage County Substance Abuse Community Coalition and battling the opioid epidemic. And so over the past few years, all of our partners have been working so hard to battle this terrible addiction epidemic that's faced our county as well as the rest of the state and the country. And so I just want to say thank you to all of our partners, our providers, Town Hall 2, Coleman Services, Family and Community Services, Children's Advantage that treats the children of the parents who have addiction problems, all of our community partners, the Health District, Jobs and Family Services, the DD Board, all of our children's partners, and as well as our funders, the money we receive from the Ohio Mental Health and Addiction Services, special funds we receive from the county commissioners, and especially all the residents of Portage County, which gives such overwhelming support to our levy each year and really provide the bulk of our funding. Also want to thank our board of directors. Our board chair, Bill Noem, will be helping us present the Crisis Intervention Team Officer Awards at noon. And all of our board members, we appreciate everyone's hard work, and hopefully I'm not forgetting anyone, the courts, the schools, I see some of the superintendents here, everyone that works together so closely. As I've always said, I'm so impressed with how collaborative Portage County is, and I think that's really a key to getting things done. Some real quick housekeeping issues. In your packet, you have the agenda, but two things I want to call your attention to is the compassion, satisfaction, and compassion fatigue scale. We asked you to take a look at that and fill that out during lunch. We'll have a presentation in the afternoon towards the end of the day, and we want you to all have that completed to be able to participate in that presentation. And then also, if you can, please, before the end of the day, complete your evaluation. We really appreciate these. Some of the feedback we've gotten was including more mental health topics and expanding our conference, and so that's what we've done this year. So I want to go ahead and introduce our first speaker. We are so fortunate to have Lori Criss. Lori is the director of the Ohio Department of Mental Health and Addiction Services. And Lori's Director Criss is a native of Eastern Ohio. She's been engaged in behavioral health field since 1992. Her experience also includes working for the Ohio Commission on Minority Health, and she was the executive director at Amethyst Incorporated, a large behavioral health treatment facility for many years. Prior to coming to OMAS, she also served as the Chief Executive Officer of the Ohio Council of Behavioral Health and Family Service Providers. And Lori this morning is going to give us an Ohio update, so please welcome Director Lori Criss.
Thank you, John. Good morning, everyone.
Good morning.
It's fun to be here in Portage County, see some familiar faces, and really, really great to hear how many different collaborative partners are here in the room too. You know, tough times bring people together, but the fact that you're sticking and staying together over the series of years and years is really important. So I think there's something for all of us to grab onto in this presentation, and if there's time at the end, I'm happy to answer any questions as well. So thanks for having us. When Governor DeWine was sworn into office in January, he did a few bold things in the very first minutes after taking the oath. And that were related specifically to people living with and recovering from mental illness and substance use disorders. And one of them was the creation of Recovery Ohio. Recovery Ohio is an organization that operates out of the governor's office that coordinates efforts to help prevent and treat and support people in recovery from behavioral health conditions. And so while 100% of the people that we serve at the Department of Mental Health and Addiction Services are living with these conditions, every department in some way has constituents that are needing or engaged in services. So we're working to make sure that the policies, the resources, and the efforts of the Department of Aging, Veterans Services, even public safety and how officers there are engaged in opportunities to better serve Ohioans and their families who have behavioral health conditions is a really important part of this work. He also elevated prevention, and that's something that you don't see most elected officials do, frankly, because prevention is something that takes decades. You plant a seed and then a long time from now, we'll see the benefit of it. It doesn't really fit into an election cycle, right? But Governor DeWine recognized that the work he's doing today will outlive his tenure as governor and maybe even his time on this earth, or all of our time on this earth. But if we don't plant the seeds today, the future Ohio will never be better. And so by directing us to have a leadership role in prevention within our department was an important part of that work too. And then he created an Office of Children's Initiatives, and this is really to help kids from birth through early adulthood succeed in life and be set up to be successful adults, with a particular emphasis on multi-system youth, those young people among us that are struggling with social or emotional disorders and really need additional support. They're engaged maybe in child welfare or have IEPs in schools or youth services, and they're really struggling across different systems to make sure we meet their needs. So these are his top priorities, and he's a really hands-on governor. Have any of you had a chance to hear him speak or meet him? He is a super hands-on guy. Like, we get emails from him every day saying, read this article, check this out, this is happening in this part of Ohio. Did you know this is going on? Have you heard of this research? I really appreciate that about him. His directives to us are to listen, that people come first, be pragmatic, don't be bureaucratic. And so I hope you're feeling that from us in our work, because we really are taking that to heart. Here's a little bit more about Recovery Ohio. It's not just a policy initiative at the state level. There is a group of 30 private citizens who are engaged in this work and came together, and they made recommendations in these different areas, 75 recommendations for work that needs to be done during the tenure of this administration and beyond. And so there's lots of opportunities here for us to align our strategic initiatives with the Recovery Ohio plan, to collaborate with other state departments and then local communities to build these things out. One of the other things that the governor is really focused on right now, and actually he was doing this work before the tragedy in Dayton, where we lost 9 of our fellow Ohioans in the shooting in the Oregon district, to really make sure that Ohio is a safe community, not just from events of mass violence, but that every day families feel safe and supported living in Ohio. And so after the Dayton incident, I don't know if you saw the press conference, people in Dayton were really frustrated and they were yelling, do something. And he takes that very seriously, very personally. And so he put together a 17-point plan. Strong Ohio is what it's called. For us in the behavioral health space, what he's looking at is, while people with mental illness and addiction are not violent, we do have to look at the opportunities that we have to support people with mental illness and substance use disorders when they may be a danger to themselves or others. So this became an opportunity for us to build some of those policies into the work that we're doing. So most of it's really focused on background checks and guns, but we do have opportunities to improve the assisted outpatient treatment process with this bill, and to update some of the language specifically around removing the requirement for families to be able to demonstrate that they can pay for treatment if they're using a probate court system. Also creating an opportunity for law enforcement to intervene if there's someone who is high or drunk and they are threatening with a weapon or are known to have weapons, to either be maybe a danger to themselves through suicide attempt or to others through domestic violence or community violence. And so we're working on these initiatives at the state level as well under Governor DeWine's leadership. I want to talk a little bit about some of the transformation that we're doing within the Department of Mental Health and Addiction Services too, to be better partners to you and the community. The past several years have been rough for local communities in a number of ways. The opiate crisis certainly has hit Portage County. The increased suicide deaths and completions in Portage County is something that weighs heavy on our minds at the state too. And over the past few years, at the state level, it has been so focused on financing and behavioral health redesign and Medicaid policy and practices, and we got a little bit too far away from remembering that this is about people, and this is about clinical excellence, and this is about helping support families and what they need. And so within the department, we're really refocusing on that, and these are values that we're living out each day. So I hope that you feel them, and I encourage you to connect with us. Contribute and collaborate being the top priority for us. Being a good partner means listening and hearing what you need and being thoughtful about being responsive to that. And collaboration is a two-way street, so we want to make sure that we're being good partners. Delivering quality is something I really want to focus on too, because we have access to a lot of information at the state level, and we want to share that with you and give you a quality experience, but also support the quality work that you're doing in your local communities. So you'll hear more about that and about accountability, data collection and management, making sure that we have what we need in data to tell the story of what's happening here in your county so that we can advocate for the resources and design things that will be really supportive of your work. We're also using SAMHSA's definition of recovery. And this is important because recovery is a lot more than just not using alcohol and drugs. It's a lot more than sobriety. It's a lot more than the absence of symptoms with mental illness. It's about being healthy, mentally healthy, physically healthy, so that a person can be well. It's about having a safe, stable, supportive home environment that supports someone in their wellness too. It's about finding purpose, whether that's parenting or being an aunt or uncle or volunteering or being a student or working, finding something to connect to in the bigger world around myself. This is one that I learned a lot about working in treatment for almost 20 years, is that spirituality is that sense of connection, a healthy connection to myself and to the world around me. And that's what we're talking about with purpose, replacing and helping people translate skills and behaviors maybe that they had in days when they were using into ways they can connect in healthy ways in the community. And then being connected to community, being a good neighbor, being engaged in the world around them in a different way, and having the community embrace and support the opportunity for recovery too. It's a rough place out there for people who are early in recovery. I know over the past 10 years, I've noticed things like, you can go to a movie theater now and there's a bar. Movie theaters used to be a safe, sober place to hang out. Now all of a sudden there's alcohol available, when you walk in the front door, at least in Columbus. I don't know if that's happening here, but there are just ways that culturally we're not as supportive of healthy lifestyles as maybe we used to be. And so we're focused on creating those opportunities. And that really brings me to the next point, which is for a long time, I think we've thought about recovery and wellness as something that a person chooses, right? We know that mental illness and substance use disorders aren't personal choices. They're not moral failings. They're actually brain diseases. And we have the responsibility as a society to help people manage their wellness and recover and to prevent those illnesses in the first place. But if we just base it on motivation, which is a person's thinking and emotional response, or we just base it on capacity, which is their physical ability or their psychological ability to engage in recovery opportunities, what we're really doing is continuing that idea that they're not ready for treatment if they're not successful. successful, or they haven't hit bottom yet, or they're choosing to be homeless. They don't want to come in for counseling. And those things might be happening because we don't have opportunities in our community that meet a person with what they need, when they need it, where they are. And so we see at the state level, and I can tell that you're doing this in your local community from talking to folks here who are on the ground doing the work, that you're creating those opportunities too. And that's our responsibility at the state level. So motivation, capacity, personal responsibility is certainly part of it, but not without the responsibility of all of us creating opportunities for recovery as well. We have a lot of priorities. I'm not going to read every one of these boxes, but I do want to highlight a couple of them for you. Children, youth, and families is one. I know that you have a project here around building a centralized center for collaborative opportunities for people to come together as families and get what they need. So not a place where kids have to go, a place where moms have to go, a place where adult men go in separate forums. Not a place you go for behavioral health, and a place you go for immunizations, but one place where you get everything. That's the approach that we want to prioritize in the department too. Really thinking about families and what families need. And so it's very exciting to see what is on the horizon here. And I'm looking forward to coming back when you're open and really pursuing that work here. Because we know we have a responsibility not just to design a system for adults with mental illness and addiction. We have to think about kids too. And a lot of times when we think about kids, we think about prevention and preventing drug and alcohol use. But we're talking about kids who need mental health services and supports too. And so really building out that full continuum for children and youth, and including families along the way. A couple of other things I'll just highlight quickly is we do want to do a more coordinated strategic look at suicide prevention. And we've had suicide prevention initiatives in the state of Ohio for a while. We're working with the Ohio Suicide Foundation, who is engaged in creating a strategic plan right now with a lot of partners from around the state. And we want to use that at the state level to make sure that we've got a coordinated plan and not just some different evidence-based practices that are happening around the state as well. You can see our priorities and our intent and our philosophy in the budget that we put together this year. So we asked for more money than we've ever asked for. And the governor encouraged us to swing for the fences, and so we did. And the legislature supported all of it. So if you haven't thanked your state representative and senator, you need to do that because they came through in flying colors and they invested in things that they hadn't before. So I'll tell you a little bit about those now. Crisis services is something we're really invested in. And we had a crisis academy earlier this week, and I know John was there and some other folks from the community were there as well. Our intention with that was just to start a conversation so that we have a more consistent way about thinking about crisis response. That not everybody needs the same exact thing, but everybody deserves to be able to get the services and supports they need when they're in crisis. In the conversation on Monday, I kind of started thinking about, we have kind of a Goldilocks system right now. Sometimes when a person shows up for services, they're too sick or they're not sick enough, and you gotta be just right to get help in what you need, and families are often left kind of in flux. We want to create opportunities for people to get what they need, again, when they need it, and to have that either mobile response or place-based response that's helping them. So these investments, some of them are continuing investments from the previous biennium, some of them are new investments. The infrastructure development is really intended to build on the crisis academy work and to use evidence-based practices in local communities to build on what you have that's working and fill in those gaps where you need different things. And then the stabilization flex fund is really to help bridge those gaps that just aren't something that you would normally have money for to help an individual or a family in their crisis. Again, we're looking both at substance use and mental health crisis. So substance use could be that a person overdosed or that they're intoxicated in a way that's a danger to themselves or others. But we know that opiates aren't the only thing that people are using. We're seeing an increase in cocaine, we're seeing an increase in meth. And so we need to be able to respond to those crises as well. Making sure that we're looking at the crisis needs of both children and adults and not just designing an adult system and then expecting the kids to be treated like little adults. We don't want to do that. And then strengthening the collaboration, which you guys clearly demonstrate throughout Orange County. We have a lot of different initiatives already underway at the department, and these will continue. The Engage grant is really working with kids 15 to 24, so those transition age youth who are moving out of maybe foster care or their parents' homes into an adult scenario where they need to support in successfully managing that. Also looking at first episode, not just psychosis, which is work that we do with Neomed here, but also any mental illness and how we can make sure that when a young person has that first episode, that we catch it and we intervene then, and don't wait until they languish in those symptoms and in those experiences before we support them. We've got money coming for prevention education for every kid in every classroom, kindergarten through 12th grade. So this is really school-based prevention. This is different than the Department of Education's money that they have for wellness activities within the school systems. This is really geared towards that universal and primary prevention initiatives for kids in schools. And we'll be releasing this information in the next few weeks around how we'll be working with local boards and community partners to help partner with school systems to assess what they have that's working. Program that's a partnership between child welfare and substance use treatment providers and trauma treatment providers to support both adults in getting what they need and kids in getting the trauma care they need. And then we have an investment in stigma reduction. We know that this is hard work that families do each day and that you do each day in supporting them, and that discrimination is alive and well. And so we want to make sure that people understand that these are illnesses and that people who need help and support have immediate access to information that they need to get services to. So you'll be seeing more of that from us. We're really engaged with the criminal justice, our criminal justice partners, and we have a number of opportunities to continue that work. The Community Transition Program is a program that supports men and women who are reentering from the adult prison system and their success in local community access and treatment, housing, peer support, employment opportunities. That's something that we're transforming this year, and we'll continue to learn together about what we need to do there. Also, working with crisis intervention training for officers, and I know you have some awards for that today, and Neomed's certainly a great partner in that work as well, and how we can expand that. Ohio has 12,000 officers already trained in this, which is phenomenal. We're top across the country, and we're just going to keep rolling with that. We've got new investment for those smaller police forces that maybe have to backfill a position to send someone to training and haven't been able to afford to do that. We want to support those smaller forces. Also, the State Highway Patrol has announced that they are going to be doing CIT training with all of the State Highway Patrol officers too. So we're looking to expand this practice across the state. Workforce development is something that comes up in every place that I visit and every conversation that I'm in, and really thinking about what we need to do to build a behavioral health workforce. The peer workforce, the paraprofessional workforce, the professional workforce, to look at really understanding what professions are needed and how to build that out and how to support peers in becoming certified and bringing great value to the recovery management process for so many people. But we also want to do some citizen workforce. So how do we do more mental health first aid training for both adults and youth? How do we make sure that people who are really on the front lines, like any one of us, if we see someone having a chest pain, we know what to do to call for the next step of help, and we know what to do to help someone if we've taken CPR or first aid. How do we do that so that people who are in a mental health or addiction crisis have that same kind of community support as well? And then we also are pursuing, or we're going to be releasing some information about loan repayment and tuition assistance funds available to us, and funds to support supervision so that people can advance into degrees and credentials. Some of the cultural shifts that we're paying attention to, what you are doing today in your everyday work is changing every day as well, as we look at the impact of social media and how it's impacting the mental health of young people. We're seeing increased rates of anxiety and depression, and these are things that research is linking to a certain degree to social media and the dominance that has in young people's lives. So we're thinking about that. What does that mean for the young people you're seeing today? But what's that going to mean when they're college age and they're on campuses and they're experiencing some of these symptoms maybe for the first time in their lives? We know we have a rising suicide rate. Again, I know that tragically you've experienced that here in Portage County. That's a statewide challenge. And we're very concerned that we're seeing the average age, the lifespan of Ohioans decrease for the first time because of overdose deaths and suicides. And we know that middle-aged men are particularly at high risk, teens are at high risk, but we've seen suicide deaths as young as 6 in the age of Ohio, and we've got to do more and better so that people can connect to help and support and help and not feel like that's the best option for them. We're very concerned about vaping. I think you've seen some of the initiatives that have come out of the governor's office and the state house on this, raising the age for tobacco to 21, including vaping products that are nicotine-based as well. And vaping in particular is concerning because the nicotine concentration in those products are so much higher than what a young person would get in a cigarette. And so their dependency on nicotine through vaping can take hours or a day compared to the weeks it might take if they were using cigarettes. And they're marketed towards children, and I think you've probably all seen this in the mainstream media, but cigarettes are not mango flavored, so kids aren't necessarily going to pick cigarettes up at a young age like they would a vaping product. I have a friend whose 7th grader asked for a vape pen for her birthday, and I say that not because the parents are doing anything that would create a condition, but societally and within her age group, vape pens are so normal, she didn't even realize it wasn't something that you would ask for as a gift from a parent, you know. So we've really got to reverse the culture around what's normal for young people. We know that if a young person has a trauma history or anxiety, depression, impulsivity, a family history of addiction, being exposed to substances at young age increases their chance of developing a substance use disorder in adulthood. And so kids vaping at 10, 11 years old is not healthy and is really putting them at risk. We're concerned about the increase of stimulants. We focus so much on opiates, and rightfully so, but we are seeing an increase in stimulant prescribing and in illicit stimulant use too, so meth, cocaine, and then we're seeing opiates, fentanyl laced into these things. So while we're seeing a decrease in prescription drug opiate overdose deaths and heroin overdose deaths, we're seeing a rise in stimulant overdose and fentanyl overdoses. So we need to really monitor these things as well. And then really thinking about young adults, we're doing more and more work on campuses, and campuses are very attuned with the mental health needs of their students and the addiction prevention needs for their students, binge drinking initiatives. But not all young people go to college, and so we need to make sure that we're supporting those young adults who are in trade schools, who are working, entering the workforce, and how are we making sure that we're connecting to them to support their mental health needs too. So I mentioned before that the governor's got some swing for the fences moments, and these are the ones that we're kicking around at the department and starting some initiatives around. Early identification and intervention. We know the signs and symptoms of mental illness. We know the signs and symptoms or the risk factors for young people who may develop a substance use disorder. We know that 75 to 80% of these conditions develop before a person's 25. So we have an opportunity to do more education, more screening, more connection with parents and caregivers earlier in life. So we're thinking, what if in that first pediatric visit, 2-week appointment after labor and delivery, we just talk to parents around, here's what you need to think about mental illness and addiction. Do you have a family history? Just like we would, do you have a family history of cancer or of heart disease or of any of the other 40 conditions that I have to answer every time my kid plays sport, right? We've all done this, right? But we don't do it in our pediatric care, and the pediatricians don't necessarily look at it when your kids get to that middle school age or high school age where they're starting to have that private conversation around vaping and drinking and high-risk behaviors. So really integrating this into a primary care setting, into school-based opportunities, into emergency departments, at children's hospitals, so that we can just give parents information that are more universal prevention and targeted in intervention. And then the other thing we want to do is better connect Ohio's institutions to our communities like yours. What are we doing to build good connections between the state psychiatric hospital and community-based care, so that if you have someone that's in crisis, we can get a person in quickly and help them stabilize and get back to the team that they were working with in the community, or that we can help discharge plan someone who's in one of our state psychiatric facilities so that they can get connected to care and peer support so they can have sustained recovery and wellness. Same with jails, courts, prisons. What are we doing to intentionally make sure that when we have these opportunities with people who we know have behavioral health conditions, what are we doing to connect them to a community that's welcoming and supportive of their recovery? Schools are a very important part of the institutional structure in Ohio, not just kindergarten through 12th grade, but preschools and early childhood learning centers, and 2- and 4-year colleges and trade schools too. So how are we connecting these institutions, place that we know young people go, and making sure they're connected to communities too? I know up in this area, there's some small colleges and they don't have the resources to have a mental health staff person or a substance use treatment staff person to support students. Some do, and that's fantastic, but not all do. And so how do we build those collaborations and connections to community-based providers to support those needs? So we're starting to look at all of this. Housing is going to play a big part of it. I know that's a barrier that we hear over and over and over. A person's reentering or they're leaving a hospital and they don't have a safe place to go back to. They burn all the bridges they've had with family and friends who have tried to be supportive. Or those family and friends just don't know what to do to be supportive. And people need to live in an independent environment that will be supportive of them too. So how do we not confuse independence with alone? And how do we create high quality environments and help finance those? Many of you probably know that recovery housing is something that I've been passionate about for a long time and been working in not just here in Ohio, but nationally. But it's not just recovery housing that we want to promote at the department. We really want to look at adult care facilities and how to make sure that those are high quality, permanent supportive housing, and make sure that that's available to people who aren't chronically homeless too. So really starting to look at that full continuum of housing options. At the end of the day, we talk all this policy and funding and ideas, but the one thing that I want you to know is that we don't forget that what we're really talking about is our brothers and sisters and sons and daughters and moms and dads and neighbors and friends, the people of Ohio who are working so hard every day to either be well, get well, or stay well. And that's our commitment, that we will continue to keep these faces and these loved ones in mind and not just let it become a policy or financing exercise. So we look forward to working with you over the next several years. Here's more information about our organization. Call anytime and we'll help you get connected to the people that have the information you need. Use our website too. It's got a lot of great resources, free toolkits, videos, information you can download and use in your local community. So I hope you'll stay connected to us. Sign up for our listserv. We have newsletters and news events that come out regularly that tell you about resources that are available. And we want to partner and support your good work. So thank you for having me here today.